Hello, everyone. Welcome to Cracking Addiction. My name is Ferghal Armstrong, and today we're going to talk about the epidemiology of alcohol and alcohol misuse. And a lot of this data is going to be derived from the National Drug Strategy Household Survey pertaining to 2022-2023. So, first of all, what is a standard drink? And we need to acknowledge that when we're reading guidelines from different countries, the definition of a standard drink varies from country to country. So in Australia, a standard drink is 10 grams of alcohol. In Canada, a standard drink is 13.45 grams of alcohol. In the USA, a standard drink is 14 grams of alcohol. And in the UK, a standard drink, otherwise known as a unit of alcohol, is 8 grams. So there is a significant variation in our basic definition of what is a standard drink, which of course adds to the confusion. A second source of confusion, which actually compounds on the first, is that there's a difference within guidelines between nations about the actual recommendations for total weekly alcohol consumption. So in Australia, we recommend a maximum of 10 standard drinks per week and no more than 4 standard drinks on any given day. So that's basically 100 grams of alcohol per week and no more than 40 grams of alcohol on any given day. And that is going to be relevant later on as we talk about risky drinking, which by definition exceeds those limits. Now compare that to Canada, where they've actually said that to actually avoid all risk of harm from alcohol, you shouldn't be drinking any more than 2 standard drinks a week, which according to their definition of a standard drink represents 27 grams of alcohol a week. In the UK, guidance suggests that you shouldn't be drinking any more than 14 units per week, which is 112 grams per week. And in the US, there's a gender variation. So men should be drinking no more than 2 standard drinks a day or 14 standard drinks a week, which is 196 grams of alcohol a week. And note, that's almost double the Australian maximum per week. And women shouldn't be drinking any more than 1 standard drink per day, 7 standard drinks a week, which is 98 grams of alcohol per week, which is roughly the same as the Australian guidelines for everyone, including men. So therefore, a standard drink in Australia is 10 grams. Well, what does that look like? So a bottle of full-strength beer, 1.4 standard drinks, a glass of red wine, 1.6 standard drinks, 150 mils glass of white wine, 1.4 standard drinks, 1 glass of port, 60 mils, 0.9 standard drinks, and 1 shot of spirits, 30 mils, 1 standard drink. So again, you have to be careful about the standard drinks in the drinks that you are drinking. You need to look at the alcohol content. Now, I said that this talk was going to be based on the National Drug Strategy Household Survey 2023. So when we're thinking about alcohol consumption, we're thinking about in particular risky drinking. And remember, that is more than 10 standard drinks per week, more than 4 standard drinks on any one day. In Australia, people who drink more than that in the last year, in 2023, the rate was 31% of those surveyed, 31% of the population. And that breaks down to 25% of people drinking more than 10 standard drinks a week, and 24% of people are drinking more than 4 standard drinks on any given day. So this gives you roughly the idea of people who are drinking hazardously and risking alcohol harms. Now, it's interesting to note how they describe themselves. People who drink at levels that put their health at risk, i.e. more than 10 or 4, 10 standard drinks per week or 4 standard drinks on any one day, they were more likely to view themselves as social drinkers or light drinkers. And for people who were drinking less than 10-4, they were more likely to describe themselves as occasional drinkers and light drinkers. So it's interesting to see that people who are drinking it to excess actually consider themselves more often than not social drinkers. So this talks about the way that we're able as a society to try and minimize the risks of alcohol. Now, the results from the 23 household survey also gave us various insights into the rates of hazardous drinking for people who were living in remote areas, people who were Indigenous, and people who had varying sexual orientations. And overall, the rates in all of those three groups, according to this household survey, were trending downwards compared to 2010. But if we look at this in more detail, if you live remotely, you are 1.4 times more likely to drink at risky levels. First Nations people, if we look at specifically drinking more than 4 standard drinks per occasion at least once a month, First Nation peoples are 1.2 times more likely to drink to that level, but they're 0.9 times likely to drink more than 10 standard drinks per week. So actually, they're less likely than average to drink at risky levels defined as more than 10 standard drinks a week. People who are gay, lesbian, or bisexual, they're 1.2 times more likely to drink at risky levels. And remember, that risk level is set at 10.4. Now, if we look at psychological distress also influences drinking. So in this survey, psychological distress was measured by the K10 questionnaire. And if we look at the prevalence of psychological distress, roughly 24%, 1 in 4 people, demonstrated moderate levels of psychological distress, and 1 in 5, 16.8%, demonstrated very high levels of psychological distress. And this translates to a higher level of risky drinking. So if we compare people who have low levels of psychological distress, their rate of risky drinking is 30%, whereas people with overall a very high or high level of psychological distress, their rate of risky drinking was 39%. Now, if we break that into 10 and 4, so remember 10 standard drinks per week, that's one cutoff for risky drinking. People who weren't psychologically distressed, 25% of them drank more than 10 units a week, more than 10 standard drinks a week. Whereas those who had high or very high levels of psychological distress, 30% of those individuals drank more than 10 units per week. So if we look at people who are drinking more than 4 standard drinks on a single day within the last month, people with very low levels of psychological distress, they only had 22% rate of drinking more than 4 standard drinks on any one occasion. Whereas people who had very high levels of psychological distress, their results came in at 33%. So overall, we can see that there's a positive correlation between level of psychological distress and the amount of risky drinking that people engage in. Now, if we look at harm under the influence of alcohol, overall, 21% of people were subject to harm by someone else who was under the influence of alcohol. And that harm can be verbal abuse, physical abuse, or, as the survey puts it, being put in fear. And generally speaking, the rates are actually rising for women and falling for men over time. And women were 1.6 times more likely to be put in fear as a result of someone else being under the influence of alcohol. Now, if we look at the gender variation in the rates of harm, so if we look at verbal abuse, women experience 17.6% their rate of verbal abuse, and the same with men, 17.6%. Physical abuse, roughly the same as well. Women, 5.3%, men, 5.2%. But remember, putting in fear, women, 14.7% versus men, 9.1%. And that's where we get that elevated risk for women. Now, if we look at risky activities whilst under the influence of or being affected by alcohol in the previous 12 months, 1 in 4 people, 25%, who consumed alcohol at risky levels had taken part in at least one risky activity whilst under the influence of alcohol. So compared to those who drank alcohol in a way that reduced health risks, i.e. less than that 10-4 threshold, people who drank to hazardous levels were 18 times more likely to have verbally abused someone, 8.3 times more likely to have created a disturbance, damaged something, or stolen goods, 5.4 times more likely to have gone swimming, 3.6 times more likely to have gone to work, and 2.9 times more likely to have driven a motor vehicle, all whilst under the influence of alcohol. And then if we look at injuries due to alcohol, compared to those who didn't drink hazardously, those who consumed more than 14 times more likely to experience an injury requiring medical attention. So the rate was 4.2% compared to those who didn't drink to risky levels. And 10.5 times more likely to have experienced an injury requiring admission to hospital. That's 2.1% compared with 0.2%. So we can see that overall from the data, alcohol consumption, yes, is trending down, but is significantly associated with harm, both to the patient from other people who are intoxicated, risks to self because of risky activities, and fear. People are more likely to be put in fear as a result of being exposed to other people who are intoxicated, and especially women. And we can also see that there's some variation in terms of remoteness, in terms of First Nation status, and also in terms of sexual orientation. So overall, thankfully, the rates of hazardous drinking are coming down, but there is still a way to go, and there are still significant harms. That's all for today, folks. My name is Dr. Ferghal Armstrong, and this has been Cracking Addiction.